Hey y'all, my name is Michaela and I am a registered nurse who has worked in the world of hospice for many years. And today I just want to talk about different signs and symptoms that you could see when someone is beginning to pass away, when they're entering the dying process. Now, please forgive me because I did write down some notes so I don't forget anything. Before I get started, I want to let you guys know that this is my opinion, and these are just like the top things that I look for. But there are many other signs as well that could indicate that death is near. But again, this is just for me, and let's just get straight into it. So, for the first thing I have, when you can tell that maybe this person could be passing away, and that's when they simply just tell you. It's not anything difficult or a huge challenge. It's just that simple. And what I mean by that is they could say, I'm going to be with the Lord. That's simple. Or they can say, John's here to get me, someone that they may know. Or the angels are here to take me home. Or just anything along those lines. And I know for you healthcare providers out there, that is something that we really see like all the time. And people who have had experiences taking care of those at the end of their life, if you've also seen this or you also have heard this, it's so common for them just to say that I'm passing away, or I'm going to be with God or with Jesus. Just that simple. Now, I'm not saying every time that's said that that's what that means, but in my experience in over 10 years, that's definitely been a huge indicator that we could definitely be getting to the end stages. Second, what I have here is any type of mental changes, and that kind of goes along with what I just listed. And what I mean by that is any type of cognitive change. And I can give my personal life for an example. For my grandmother, when she passed away, she became more confused. Now, she was confused already, but she just became just more confused to the point that she didn't know our names. And we were people that she saw all the time. And my aunt, her daughter, she saw every day. But for some reason, our names just weren't clicking. And she too was having some hallucinations and delusions, which was something that had never happened before. But at the end of her life, I would say maybe a few days prior, she had the increased confusion. For some other examples, they may see children all around, or a ball roll across the floor, or cats in the corner. Just things that aren't there. But when you start to see those mental changes, it could definitely be a sign that things are coming to the end. Could be, again, could be. So let's go to my next sign that I am familiar with. And this is changes in vitals. So, and when I mean changes in vitals, I mean like something out of the ordinary. Now, if their blood pressure always runs low, that's not unusual for this person. But if their blood pressure is usually 138 over 79, and now today we're 80 over 40, that's a big difference, especially if they haven't had any medications to bring down the blood pressure. So some vital changes that we start to see at the end of life is, again, that blood pressure goes down. We start to see a decrease in the heart rate. Sometimes that heart rate can elevate as well, depending on how comfortable or uncomfortable the patient is. But typically their heart rate goes down. Temperature, that also fluctuates. I've seen people have fevers. I've also seen people be very cold to the touch and have a decreased temperature. Again, we're looking for things out of the ordinary, things that are not usual for this patient. Respirations and breathing patterns. Breathing can become labored, where they have a very hard time breathing. And then breathing can also become very shallow, where you can barely tell that the person's taking a breath. There's been times where I had to put my hand on the patient's chest to see if it rises, just to feel. I do know another nurse who will sometimes put a mirror in front of the patient's face to see if she could get their breath on the mirror to see if it kind of fogs up. I never had much luck with that. I'm not even sure if I ever tried it. But for me, I always try to put my hand on the chest or on the stomach area. And another change in vitals, which is one of my favorites, but I do know that some hospices, and I also have heard that Medicare doesn't really have much care in this type of vital. But for me, it's the oxygen saturation. That's like my favorite indicator of when someone is becoming the end stages of their illness. And I was taught by an old school hospice nurse, and when someone's oxygen saturation is out of the ordinary for them, number one, and starts to get into those 80s and 70s, we're definitely headed home. Again, things out of the ordinary. Now, if you have COPD and your oxygen is always in the 80s, that's not out of the ordinary. But for someone who is usually in the 80s and their oxygen starts to go into the 70s, or someone who's in the 90s going to the 80s, then that's an indicator that things could be imminent. So, vital signs. Let's see, what else do I have here for number 4? Again, my personal thing. But for me, it's when the person is not eating as much as they used to, or any type of change in their eating and drinking habits. One of my favorite ones to kind of look for is the patient who loves coffee. And when I first meet them, they're drinking 2 and 3 cups of coffee a day. And then 6 months into our relationship, they go down to drinking 1 cup a day. That's a change. That's a decline. Now, towards the end, that 1 cup is not being touched. They're no longer drinking that coffee. For me, that's a huge sign that something is happening. Something's going on. Again, doesn't always mean death, but it definitely could be that we're headed towards the end. And I will do a video that kind of describes the difference between declining and signs of death, because death or dying and declining are 2 different things. But I will do a video that touches on that one day. Let's see, do I have any more notes? I did want to make a point that when you start to see that a person is not eating as much, do not force feed that person. It's not good. Please, I know it doesn't sound like the humane thing to do, but when someone is passing away, they're not hungry. You know, our body organs are shutting down. The kidneys are shutting down, the colon's shutting down, the liver's shutting down. You don't want to keep putting food in a body that cannot digest food anymore. You're causing so much pain for the patient, because the food isn't going anywhere. As we get to the end of our life, we stop pooping and peeing. We don't pee as much. We don't poop as much. So don't put food into a body that cannot be digested. You know, we'll start to see that the belly becomes very distended and sticks out, and that's painful. It's very uncomfortable. So, and I will do a video on that as well, just to talk about force feeding, and don't do it. The best thing you can do at this time is to do mouth care. Wipe the mouth out with a rag, use some chapstick. You could even use ice chips, but I wouldn't force feed or force drink. And especially if the patient has a feeding tube, talk to the medical director or talk to your hospice team about how to stop the feeding tube feedings. Because if the food isn't going anywhere, it's just not a good thing. Not at all. Number 5, for me, in my opinion, is changes in skin color. Now, when I say changes in skin color, the medical term for that is called mottling. And mottling is where, from how I was taught, at the end of life, the heart is not pumping as much. Again, we talked about that heart rate going down. So the heart isn't pumping. So if the heart doesn't pump, it's not sending blood throughout the body, and circulation is decreasing. And when circulation becomes slower, we start to see that the skin changes colors, and that the skin can turn from like a blue to red, purple color. And typically you'll see it start in the feet, like at the bottom of the feet or on top of the feet. I've also seen it start in the back, like on someone's back. And it can, honestly, it could be anywhere. But that is a huge sign when circulation is slowing down. It's due to the heart rate slowing down. And mottling is a huge indicator that death is imminent. So that's something to truly look for. If you start to see that, I would definitely encourage you to talk to your hospice worker or talk to your doctor about that. Let's see. And I think I have one more here. For me, my last sign that death could be imminent is increased time spent asleep. When someone gets to the end, or when someone's coming to the end of their life, they could sleep up to 24 hours a day. And again, we want to look for things that are out of norm for this patient. So if you notice a year ago, your loved one slept, 10 to 12 hours in a day, and you thought that was a lot. Like, how can you sleep that long? And then as time goes on, they start to sleep 16 hours a day. And you're like, oh my goodness, like they're never awake. And now when we start to pass away, or as we start to decline even further, we can sleep up to 24 hours a day. Usually we start to see between 21 and 24. And so we're sleeping a lot. We're not eating as much. We start to see changes in skin color. We're starting to see a decrease in the vital signs or increase in other vital signs. Any kind of mental change that's not normal for the patient. And then again, the patient just says, I'm going to go with the Lord. I'm going with the angels. Those are my signs that I look for. And now again, these signs that I have stated today could mean death is close, but they could also mean a ton of other things. Some people with congestive heart failure will have mottled looking skin. People with Alzheimer's, they have sundowners, which can cause increased confusion. People with COPD will have a decreased oxygen saturation. Again, you want to look for things out of the ordinary. And everything that I listed on here, there's tons of other things that could also mean that the patient's passing away. I know for some patients, their ears kind of get pulled back, pinned back to the neck area or to the back of the ear area. There's also it's called baby doll eyes, where the eyes are just kind of glossed over, like with a film, and it looks like they're like looking right past you, like looking in your direction, but there's no eye contact. And again, the eyes are just kind of glossed over. And then we start to see changes in bowel movements or in bladder. There's so many different signs that could indicate that death is near. But again, those are my top signs, and I hope I was able to help you today. Please leave a comment if you're a hospice provider or a family member or whomever. If you notice any other signs that could indicate that a person's passing away, please put it in the comments section so that other people who come to this video can also know what to look for.